Mackenzie, Julian, and Katerina present the pressing issue on whether to purchase the robotic surgical system at North Shore General Hospital. To begin, let's look at the issue at hand. Urological surgery has declined by 38%, and profits are decreasing. We have to understand why the rate of urologic surgery is continuing to fall. Dr. Jones, the chief of surgery, and Dr. Stream, the chief of urology, explain that patients are coming to their consultations and wanting surgery performed by a robotic surgical system. The printouts that the patients bring in state that the robotic surgical system offers the option of less pain, shorter length of stay, and a faster return to normal activities of daily living. Benefits of robotic surgery include short-term and long-term benefits. So let's start discussing the short-term benefits. They include a shorter learning curve for surgeons, smaller incisions, decrease in blood loss, and shorter hospital stays. These benefits are appealing to physicians because they don't have to take as much time out of their busy schedules. Patients are drawn to the fact that they get to have smaller incisions because those smaller incisions will leave minimal scarring. Also, a shorter hospital stay allows the patient to recover in the comfort of their own home, instead of their family having to come and visit them in the hospital and feeling more uncomfortable. Long-term benefits include the reduction of transfusions required, since studies show that there is a significant change in blood loss. Wound infections, such as hematomas and uterine injuries, have appeared to drop as opposed to other methods of surgery. Robotic surgeries have proven to be more effective of the total removal of cancerous tissues. Lastly, men who have undergone prostate surgery by a robotic surgical system compared to traditional ways of surgery were shown to have higher rates of success, which may lead to more and improved techniques. Now, let's move on to the risks that robotic surgical systems bring. To begin, robotic surgical systems share the similar risks of other methods of surgery. These risks include the potential of infections, bleeding, and heart attack due to anesthesia. These are all rare outcomes, but of course, we need to make sure that we are aware and try to prevent as many of these unfavorable outcomes as possible. Next is the fact that human and mechanical error can occur, and we need to make sure that all physicians and staff are properly trained. In regards to mechanical error, regular maintenance checks have to be conducted and accounted for. This brings me to my third point, that multiple parts of the robot can malfunction. Great effort in preventing these malfunctions is absolutely necessary to this hospital's success. The next risk is that the energy source has been known to shut off and leave burns on the patient. Some energy spikes have even caused nerve damage. With that being said, we are aware of the problem and can take great precaution to prevent this from happening. Lastly, the less experience one has, the more risks are involved. If implemented, training has to be a large focus. There are multiple factors to look at when deciding if a robotic surgical system should be implemented. Positive reasons include that more patients will come back after the first consultation to proceed with surgery upon learning that there is in fact a robotic surgical system at North Shore General Hospital. The robotic surgical system can be used in other areas, including bariatric surgery, gynecological surgery, and thoracic surgery. The patient will experience less pain, a shorter length of stay, and a faster turnaround time back to daily activities. There will be a reduction in human error, such as better visualization and stability, not to mention a reduction in tremors. With the robot in place, North Shore General can compete with the other hospitals and obtain more business. Now that we've talked about the positives, let's move on and talk about the negatives. So the negatives include that the $2 million price tag is expensive. There is an overall increase in the amount of time spent in the operating room. Time has to be allocated for training physicians and staff, and the cost of maintenance has to be budgeted in. When considering these negatives, we have to see if the positives are going to outweigh them. The price of the machine, that's not necessarily negotiable. However, a contract is normally included for the cost of maintenance that could possibly cut down on costs. Physician and staff training cannot really be negotiated with. It is integral that proper training is conducted to obtain satisfactory patient outcomes. And with more experience, operating room might decrease a small amount with time. Since the positives seem to outweigh the negatives, the robotical surgical system should indeed be implemented. Costs include the surgical system itself, maintenance, and training. Benefits include an increase in patients, a reduction in lawsuits due to the added benefits of better visualization and stability that will lead to less surgical errors, and lastly, since it is new cutting-edge equipment, more publicity will bring in more donations. So the next two slides are the cost-benefit analysis. And assuming that there are a 2% increase in both the costs and benefits, however, there is one exclusion. The first year of physician staff training is budgeted at $5,000, and that is due to it requires more resources that first year than it would in the other years. Because it goes to the second year, it is budgeted at $2,500, and then with more advanced, better technology ways, it goes up by 2%, like the other costs and benefits. So it is projected that the robotic surgical system should make a profit in approximately the fourth year. So as you can see on that slide, the first year projects a loss of $1,475,000. And by the second year, it reduces to $942,500. And then by that third year, it continues to go down to $366,200. Then finally, in that fourth year, you're estimated a profit of approximately $187,813. So just a conclusion of what I just said. It concludes that an estimated increase of 2% profit will be reached at the fourth year. To sum this presentation up, a robotic surgical system should be implemented. The positives seem to outweigh the negatives, and the consumers seem to really want this implemented, and if we don't, we might start to see an even worse decrease. And again, the surgical system will approximately make profit in that third, fourth year. And that is it for the presentation. Thank you for watching.